Hello, everybody. Welcome to the first episode of Mother Doctor Nurse for 2022. Well, we're a little late getting into this because, kids, stuff, but here we are, ready to bring you a child health subject and a chat about that every week for the rest of the year. Well, hope the rest of the year. What do you think, Deb? Should we do that rest of the year?
That's the intention. We've been doing it for quite a while now, so why not continue? Hopefully it's helpful.
That's right. And so today we are going to be talking about nail biting in children. And if you haven't joined us before, I'm Sarah Hunstead. I'm a paediatric nurse, a mum of two, and founder of CPR Kids. And I am joined by the fabulous Dr. Deb Levy, who is a paediatrician. And Deb, do you want to tell everybody about yourself and what you do?
Well, exactly, Sarah. I'm just that, a pediatrician. I'm a general pediatrician with a holistic approach. I'm also a mum to two girls who are 5 and 7. So I'm a proud mum of 2 school-going girls now, which is great. And yes, I practice out of the eastern suburbs as well as providing hopefully useful education for parents.
Mm-hmm. Absolutely. So my girls, watershed event. So I've got 2 in high school now.
Yeah, there you go.
It blows my mind to think I've got 2 in high school. But anyway, the whole thing we're talking about today, nail biting, it certainly happens in our family. And Deb always says, Sarah, you've always got a story for this kind of stuff. That's because I do, because my kids have gone through everything pretty much. But my oldest daughter, she did not have her nails cut from the age of 2 to the age of 12. I went 10 years without needing to go near her with a nail clipper because she was a nail biter, just like my husband is, nail biter. We tried lots of different things, but what changed for us, the reason that she stopped biting her nails was her peers. She saw that other people were growing their nails and putting nail polish on and all that kind of fun stuff. And that was the event that stopped her biting her nails. Nothing else did. But, I never asked any about it. I just bought, the nail thing from the chemist and just kind of went, oh, well, never mind. She can just keep doing that as long as she doesn't, there are some complications that can happen. But Deb, what I'd love to know is, why do kids do it? And let's go into what you can do as well. So,
okay. Someone's just made a comment, what are we teaching? So I think we'll probably just highlight that. Maybe we haven't. We're so excited just to jump on again. But today we're going to be covering nail biting, which is actually really, really common. And as always, Sarah has a personal story about one of her children, which she has just shared with us. So I think first and foremost, what I'm going to say about nail biting is that there's obviously a degree of severity, and it also kind of falls into this group of like repetitive behaviors that children can have. It's often grouped with thumb sucking, nail biting, and maybe even nose picking can be thrown in there. So I think a lot of what we're talking about here can be extrapolated to that, can be used for that as well. Nail biting can happen for a whole lot of reasons, and it can be mild to severe. I've seen children who bite their nails to the point of bleeding, and that is awful for families, awful for everyone to witness, and, very distressing. But it can just be, just that little nibble, that suck of the fingers, anything that's got their hands in their mouth. So, you're looking for a wide variety of things. And I guess the whole underlying question is, well, why are we even talking about this? Why does it matter? And it matters, obviously, if it's severe. And also, it also goes to, well, what's the underlying issue? Like, why are they doing it? And some children can have nutritional deficiencies that can egg it on. Other children can have emotional, challenges that they're trying to manage. And, the most common in terms of nutritional, the most common that I'll always look for is something like iron deficiency, because it can be grouped into this thing called pica or pica, depends where you're from and how you pronounce it. It's PICA. And what that is that the definition of that is a craving of non-food things to eat. And that can be a sign of iron deficiency. So it's always important to consider, because often nail biting is in that younger age group. I think you said with your daughter, it started when she was how old, Sarah?
She would have been just under 3 when it started.
Yeah.
Yep.
Yeah, exactly. And that's a very common time for iron deficiency anyway. Anywhere from that, the like 1 year to 5 is kind of, a very common time because of diet and demands on iron, etc. So I always think it's something important to consider. And then, looking at other nutrients based on, what the child's diet is, as well as what else they may be presenting with. Because nail biting can be really, really tricky. It can be very tricky to treat. And it's nice when there's a specific underlying cause, but it often turns out to be more behavioral. I'm not going to use the word psychological because I feel that becomes an unfortunate label to put on your child. But it can definitely have to do with self-regulation. And managing stressful situations, or even just boredom, so it can be a whole lot of things.
That's really interesting because I asked my daughter multiple times over the years, why do you bite your nails? And it would range from, I enjoy it, I do it when I'm bored, or it makes me feel calm. They're the three responses I always get. And I don't want to stop. I like it.
Yeah. That's it. I don't want to stop. And the other thing, what you said with your daughter, she decided to stop. And unless a child wants to do something, we all know it's incredibly hard to make them do something. Which is why it's so hard when they're younger, because they don't see the benefit of stopping. But obviously when they're older, they have more insight, and you can help them better and easier. Otherwise, when they're younger, it's about, yes, looking for the underlying cause, and maybe there is some anxiety there. Maybe they need some help coping with their emotions, and learning how, as I said already, to self-regulate, or to have other outlets, and use other techniques to help them calm themselves down. And often often an occupational therapist is helpful for that. Or a psychologist, but occupational therapists often have some really good, helpful techniques. The other thing is you want to deter them from doing it, and there are quite a few different steps. Should I go into that now, Sarah?
Yep, go for it.
So yes, as I said, when they're older, you can rationalize with them and speak to them about it. That's the one. The other part is deterring them, and you can deter them by either making it unpleasant, or making it inaccessible. So the unpleasant part, you probably would have all heard of, those horrible nail polishes, the tasting ones, or some people even put Tabasco on their children's fingers.
Wow.
Or something that tastes bad. Yes. And that's so to break that pattern. You want to cut that down, just break the pattern. The other part is sometimes I'll suggest using something on the fingers. It depends, if a child, and I said this can also be used for thumb sucking or finger sucking. And this is, I guess a bit more relevant for that, but you can tape fingers together. They usually only, suck 2 fingers or 3 fingers. You could tape fingers together to make it a different sensation. You can put Band-Aids on fingers, to try and again, just make them aware of what they're doing and to break that cycle. We certainly never want to punish our children, but we do want to reward them when they don't do it, and that's where the whole concept of rewards charts comes in. But obviously they have to be developmentally age appropriate for that to actually work, and motivated as well, by something that you're going to treat them with.
Absolutely. And I think that's a big thing, is that punishing them for doing this just, it does not work. If, it's because of anxious feelings that they are actually doing that. If they're being punished for something, that's just going to exacerbate the underlying problem. And so that's
100%. Yeah.
Now, I suppose we're talking here about the severe end, when we really do need to intervene because children's, their fingers are bleeding and so on. But are there complications that can happen when children are severely biting their nails? Is infection an issue and things like that?
Yeah, exactly, Sarah. Infection from a few things. Like obviously we I guess are most worried about a bacterial infection, because if they cut it, biting down and there's bleeding and the skin is broken, then it's very easy for that for bacteria to gain entry and cause infection. The most common thing would be something like a paronychia or a cellulitis, which is just infection of the nail bed and nail skin and skin, and that may even need antibiotics. So that is definitely something to watch for. And how would you suspect that? Redness and swelling. That is going to be, and pain, exactly. And that's going to be your main thing. The other thing is that with nail biting, I always think of parasites as well. So if a child has got pinworm, for example, and they're scratching their bum and then biting their nails, they're going to auto and reinfect themselves constantly. Exactly. So they're essentially getting worm eggs into their mouth, which is pretty gross. And it's the same for nose picking too. So that would be the main one is bacterial infection though.
And certainly I've seen so many kids come through the emergency department who are in so much pain because those paranoid infections, it's extraordinary how much pain they can actually cause for something relatively small. So,
well, we've got so many nerves at the tips of our fingers because, we use them for so much and they're so important. So, that's why.
Makes sense.
Painful. Yeah.
So we've talked about why kids bite their nails. We've talked about some techniques to stop them doing it and some of the complications. If anybody has any questions at all, now is the time to pop them in the comments below so that we can start to answer them. But Deb, is there anything else that you'd like to talk about when it comes to kids and biting their nails?
The other thing that in terms of complications is it can actually affect their dentition, their teeth.
Really?
Yeah. So if they are really aggressive nail biters, it can definitely affect their teeth. So definitely keep an eye on them, but more importantly, regular dental reviews.
Okay, that's interesting. And just to recap too, Deb was also saying at the beginning of this that there are, there's different degrees of nail biting. So, we've been, my daughter Tito, certainly we've talked about her today. She was never the kid who bit them right down to bleeding or infection or anything like that. It wasn't a massive problem for us, even though she did do it for a long time. But as Deb said, for a lot of families, this really is a big problem when it's looking at the underlying causes. Why are they doing this? For a child to bite their fingernails down to the point where it's bleeding and they're getting infection, you really want to, address the root cause of this. And certainly Kate has just popped on a comment that says, thankful for these videos. Thank you, ladies. You're most welcome, Katie. And Sabina has said, is thumb sucking has a similar effect as nail biting? Deb, do you want to comment on that again?
Yeah, absolutely. As I mentioned right in the beginning, nail biting, thumb sucking, and also nose picking can all be put into that repetitive behaviors or habits. And it can have similar effect, certainly with auto-inoculation or auto-reinfection of parasites. Not so much bacterial infections because they're not usually breaking the skin. But my main concern with thumb sucking is the effect on their teeth. So they'll often get a typical appearance where their teeth are pushed forward. It can also happen from dummies or pacifiers, and actually their whole jaw in the front goes forward. So it's quite a particular pattern. So that would be my main issue with thumb sucking. But yes, it can also cause infections. Just as I'm thinking, if they're sucking their finger enough so that their skin is, if you've been in the bath for a long time and your skin goes all like mushy and friable, then they certainly can get infections from that. And I think the best thing for thumb sucking is actually taping. Okay. Taping fingers with micropore or something like that, not regular sellotape, but proper tape that's safe for your skin. Because they can't get to it. It's normally this action, but then they can't get to it. So if you could tape like that, I think is a good way to do it. Plus all the other things that we've chatted about.
Yeah. So remember addressing that underlying cause as well as breaking the cycle.
Yeah. Thumb sucking is often a sleep thing as well, which is very tricky, which is why personally for my children, I gave them dummies because I was like, it's easier to take a dummy than a thumb away.
Exactly. My two had dummies as well. And, they're toys that were their thing for sleep, which still sit under their pillows waiting for them when they go to bed. They just don't get taken to school anymore. No. Yeah, not anymore. A little bit too old for that now. So thank you very much, everyone. And thank you, Deb. You are a wealth of information as
are you, Sarah. As are you.
I bring the stories. You bring all the facts. So that is a good thing. We're a good pair. So we will back again next week on Wednesdays. What we need you to do now, this is please, everyone, We want to bring the information that you want. Can you please either DM us? Can you pop in the comments below? Message us, send a smoke signal, do whatever you want, but tell us what you would like us to talk about, please, okay? Because we're doing this for you guys. So any of the child health subjects that worry you, that you would like more information about and steer away from Dr. Google, please let us know what you would like us to bring. So we will see you same time, same place next Wednesday, and we will fill you in a little bit more about what we will be talking about for the next little while. So thank you for joining us, everyone.
Thanks, everyone. Bye.
Bye.